Welcome back to GoodNurse, your AI-powered tutoring service for nursing students everywhere. Today, we're going to use the GoodNurse practice test system to go through some management of care questions. Let's get started. First, I'm going to start a new quiz and select Management of Care as the subject to include. You can select as many subjects as you'd like, and you can also change the number of questions in the quiz. First up, a patient expresses dissatisfaction with the care they are receiving. How should this concern be addressed to ensure quality patient-centered care? Is it A, listening to the patient's concerns, acknowledging their feelings, and working together to address the issues? B, blaming the patient for any misunderstandings or issues? C, dismissing the patient's concerns without further discussion? D, telling the patient that dissatisfaction is normal and not addressing their concerns? What do you think is the correct answer? If you chose A, you're absolutely right. Addressing patient dissatisfaction by actively listening, acknowledging their feelings, and working collaboratively to resolve issues promotes a patient-centered care approach. It's crucial for building trust and ensuring quality care. While we're here, let me show you a cool feature that GoodNurse provides during practice tests. After you answer a question, you can ask GoodNurse AI follow-up questions to help you better understand the topic. We also provide some pre-written prompts you can use. Here we will ask it to simplify the explanation. This is a great way to enhance your studying, and it's exclusive to GoodNurse. Okay, next question. During a busy shift, a patient urgently requests to have their pain medication administered, but another patient is due for a critical medication. How should you prioritize care? Is it A, assess the urgency and potential impact of delaying either medication, and consider delegating tasks if appropriate? B, leaving the decision to a less experienced staff member without providing guidance? C, ignoring the patient's request for pain medication and proceeding with the scheduled medication without further assessment? Or D, administering the pain medication first without assessing the urgency of the critical medication? What's your take on this? The correct answer is A. Prioritization in nursing care requires a thorough assessment of the urgency and potential impact of delaying tasks. It's about ensuring timely and safe care delivery for all patients. Moving on, a patient requires a complex wound dressing change that they will need to manage at home. How should you ensure the patient is prepared for self-care? Is it A, only providing verbal instructions without a demonstration? B, not assessing the patient's understanding or ability to perform the dressing change? C, discharging the patient with only a pamphlet on wound care? Or D, providing a detailed demonstration, allowing the patient to perform a return demonstration, and providing written instructions for reference at home? The correct answer here is D. Preparing a patient for self-care in this way ensures they have the knowledge and skills necessary to manage their wound care safely at home. Now, a nurse must ensure the informed consent form for a non-English speaking patient is understood. What is the most appropriate action? Is it A, have a family member translate the consent form information? B, use hand gestures and a calm voice to explain the consent form? C, provide the consent form in English and allow extra time for the patient to read it thoroughly? D, utilize a professional interpreter or obtain a consent form in the patient's preferred language? If you guessed D, you're correct. Ensuring informed consent means providing information in a language the patient fully understands, often requiring a professional interpreter or a translated consent form. Let's talk about discharge teaching for a patient with heart failure. Which strategy would be most effective for ensuring the patient understands their discharge instructions? Is it A, rushing through the instructions so the patient can be discharged quickly? B, using the teach-back method by asking the patient to explain the instructions in their own words? C, providing the patient with written instructions only? D, giving the instructions to the patient's family member instead of the patient? The best approach is B, using the teach-back method. This ensures the patient understands and can follow their discharge plan, promoting better health outcomes. Okay, next question. During a natural disaster, a nurse is activating the emergency response plan. Which action is most critical in the initial phase? Is it A, Immediately discharge all patients to clear beds for incoming disaster victims. B. Assess the condition of all patients to prioritize care and identify immediate needs. C. Set up a media center to keep the public and staff informed about the disaster. Or D. Start an impromptu fundraising event to support the anticipated needs of the community. The most critical action is B. In the initial phase of a natural disaster response within a healthcare setting, the nurse should first assess the condition of all patients to prioritize care based on medical needs and the severity of conditions. This assessment will guide resource allocation and identify patients who need urgent care. Immediate discharges, fundraising, and focusing on media communication may not address the immediate needs of patients and could impede effective emergency response. Okay. How about this one? A nurse is working with a family experiencing conflict over a patient's care decisions. What is the nurse's role in this situation? Is it A. Dismiss the family's conflict as irrelevant to the patient's care? B. Take sides with the family member who has the legal authority to make decisions? C. Encourage the family to resolve their conflict outside of the healthcare setting without intervention? D. Facilitate communication between the family members and the healthcare team and advocate for the patient's preferences and best interests? The correct answer is D. The nurse's role is to facilitate open communication and ensure the patient's preferences and best interests are central to decision-making. A nurse is preparing to transfer a client to a long-term care facility. What is the most important information for the nurse to provide during the handoff report? Is it A. The client's routine for bathing and dressing? B. The client's preferred mealtimes and food choices? C. The client's current health status and recent changes in condition? Or D. The names of the client's family members and their contact information? The most critical information is C. While all the information may be useful to the receiving facility, the most critical information to communicate during a handoff report is the client's current health status and any recent changes in condition. This information is essential for the continuity of care and for the receiving facility to prioritize care and monitor for further changes or complications. Let's do a couple more questions. Which task is most appropriate for the registered nurse to delegate to the licensed practical nurse? Is it A. Initiating the blood transfusion for a client with a hemoglobin of 6.5 grams per deciliter? B. Performing the first assessment on a client who has just returned from coronary artery bypass graft surgery? C. Teaching a newly diagnosed diabetic client about insulin administration? Or D. Monitoring a client with COPD, chronic obstructive pulmonary disease, who is on 2 liters of oxygen? The correct answer is D. The RN can delegate the monitoring of a stable client with a chronic condition, such as COPD, to the LPN. Initiating a blood transfusion, performing the first assessment on a post-operative client, and teaching about insulin administration are all tasks that require the higher level of education and critical thinking skills of an RN. And finally, a nurse is caring for a client who refuses a blood transfusion due to religious beliefs. What is the nurse's best response? Is it A. Explain the importance of the transfusion and try to convince the client to accept it? B. Contact the client's family to persuade the client to accept the transfusion? C. Inform the client that their decision could lead to serious health consequences? Or D. Respect the client's decision and document the refusal in the client's medical record? The best response is D. The nurse must respect the client's autonomy and right to refuse treatment, even if it goes against medical advice. The nurse should document the refusal and any education provided about the consequences of not receiving the transfusion. It is not appropriate to try to persuade or coerce the client into changing their decision, nor is it appropriate to involve the family against the client's wishes. That wraps up our session today. Remember, these scenarios are designed to help you think critically and prepare for real-world nursing challenges. As you can see with the GoodNurse system, you get a comprehensive summary at the end of the test, and you can also go back and review any question in the practice test, including asking GoodNurse AI any follow-up questions you may have. You can sign up for free on goodnurse.com and try it out for yourself. Thanks for joining us at GoodNurse, and we'll see you in the next video.